The whole reason why I started coming to Dr. Sampalis' dental practice is because I had recently had a baby. All throughout my pregnancy, like, my teeth were just doing things that they had never done before. I was always in pain, and with me being pregnant, that we were limited to the solution paths that we could take. And one day I was on a Zoom call and my tooth just came out. It was the craziest thing ever. But that's when I called. I found Dr. Andrew Sampalis. I told him what was going on. He was able to get me in immediately, removed any residue that was left from the tooth falling out, and then set me on a plan to get that tooth replaced, fix the other teeth in my mouth, get my teeth back healthy from my pregnancy. There wasn't pain that I was experiencing, but it was one of the teeth that were located all the way in the back, which is very important for eating and really crunching down and dissolving the food that we eat on a regular basis. It was kind of important that I got that tooth addressed so that I can eat as normal. The doctor did give me a few options to really fit the needs of my dental health journey. He did suggest that I do have some fills to try to save the current teeth that I have in my mouth and make like my eating habits a lot better, be able to digest food a lot easier by really breaking down the food and not messing up my teeth. And the other option he gave me was the implants. So to improve, again, my ability to eat and things of that nature, I would have to replace some of those teeth. All the doctors here made sure that they were involved with my treatment plan and making sure that, okay, we're going to do this first to make sure that we are able to salvage whatever teeth you have, and then we're going to go in and put in the implants. The process of getting the implants set up, it really wasn't that bad. It was kind of seamless and very smooth. It's kind of a step-by-step process. I thought it was like some very long, extenuating process to do an implant, but it really isn't. Once that post is in there and your gums have healed around the post so that it's set, he literally just screwed my tooth in. So it was very smooth, not painful whatsoever. I do have one implant in at the moment. We're awaiting to do the second implant, and it's like it's my tooth. He matched the implant tooth so that it really aligns with how the rest of my teeth look like, so it can look as natural as possible. Now that I have the implant and it's installed, I've been able to use the side of my mouth that I hadn't used in a very long time and feel comfortable with eating. I don't have any issues. There is no like flexibility in the tooth. It's rigid, it's stuck in there, it's not going anywhere. It doesn't cause me any pain, and it's treated really just like all the other teeth that I was born with and that are currently in my mouth. There's no difference in how they feel. I can't tell without just knowing, because I had the implant installed, but I can't tell the difference between which tooth. There's no pain. It's just like any other tooth. I am extremely happy that I had the implant installed, and I'm excited about the future implants to come.